but I'm talking to other parents and girlfriends of mine who some of their children, it's anxiety and depression, suicide, thoughts. That stuff is creeping in. I've heard that from some of my colleagues and other girlfriends and parents. And I remember you telling me the last time we spoke a little bit about the suicide rate, right?
Yes,
It has increased.
Definitely. And younger. So, just like with the adults where we had, high rates of cardiovascular disease and cancer and diabetes, and then coronavirus hit and it just made those people even more at risk.
Yes.
It's the same with our children. So, our children already dealing with anxiety, depression, trauma, basically being a child in Oakland.
Yes.
For most of our Black children, there's trauma. There's the constant fear of homicide, the constant presence of homicides. That causes trauma.
Yes.
And that then, we know there's studies, right, that talk about this trauma and how it rewires our neurons to think differently, to react differently. So you're hypersensitive, you're hyper emotional, right? All of these things that we're seeing play out in our kids, which we think that our kids are just doing too much or acting too much, but it's really a physiologic response to the stress, right, of their environments. And even though you may not live like I live,
their environment.
I live in the hills, right? But I hear the gunshots every night. Even though my kids are not living in that, in what we call the bottoms or not living there, they can hear the gunshots.
Yes.
And so what kind of stress? They're still stressed.
Yes, and on high alert. And high alert. What is going on?
Definitely to a lesser degree than a child who's actually living there and right in the midst of it.
Yes.
But still, that's the type of stress that our children are under. So now going to school is like an outlet, right? They get to play, they hang out with their friends, they get to draw. It's like a nice 6-7 hour day of them being able to escape.
Yes, and be in that kind of safe, nurturing environment. Right.
Now we've taken those kids and we've sent them home because they couldn't come to school. And now 24/7, they're in this stressful environment.
Yes.
So no wonder that our kids are anxious, more anxious than before, are feeling more depressed, have thoughts of suicide, because there's no escape. The only escape that they can even imagine in their little minds is death.
Yeah.
And that's a scary thought to think that our children's only escape is death. And we're seeing it younger and younger and younger. We're seeing 8 and 9-year-olds commit suicide.
Oh my goodness.
Versus not seeing them that young, prior to the pandemic. But that age has been creeping down. And when you think about also, like you said, you go into your daughter's room and you peek and see what is she doing? What is she watching?
Yes.
What is her environment like? That's what we have to do. You have to see, what are your kids watching on YouTube, right? What are they watching on TV? Because a couple of these kids, many of these kids have learned how to commit suicide by watching YouTube videos.
Yes.
You can find anything on YouTube.
Yes.
Anything.
Like
and so they're learning how to harm themselves on YouTube. So you have to pay attention to our kids. But like you said, if you're a single mom and you have a job that you're still working and you have multiple children in your household, like really, how equipped are you to be paying that close of attention to your children?
Right.
During your 9-to-5 job.